you all know, the National Strategic Plan for HIV, TB, and STIs 2012 to 2016 was launched by our President on World AIDS Day on the 1st of December 2011. Since the launch, we have made significant progress in the process of gearing ourselves up to ensure that we oversee and guide its implementation in accordance with the SANAC mandates. We have been going through a phase of renewal and strengthening of the governance framework to address some of the gaps and weaknesses identified in the final review of the National Strategic Plan, which expired in 2011. As the highest body which advises government on all HIV and TB-related policies and programs, SANAC continues to be regarded as a valuable engagement mechanism for all stakeholders involved in the HIV response in the country. In this regard, we are also in the process of strengthening all structures of SANAC from the national level through to the provincial and district, as well as local levels. At the epicenter of the epidemic in South Africa, this province of KwaZulu-Natal continues to identify, pilot, and roll out innovative strategies to mitigate the impact of HIV and TB in the province. The KZN Premier's HIV and TB flagship program, which effectively applies a strong bottom-up governance framework, has been identified as one of the most effective and robust approaches towards achieving wall-to-wall coverage of programs and interventions in the communities. This is precisely why we are meeting here today to learn lessons from the KZN Provincial Council on AIDS and to see policy in action.
What is the impact in the population of the NSP 2007-2011? The Medical Research Council has got what is called Rapid Mortality Surveillance Report, and it shows that there is an increase in life expectancy and a decrease in infant and child mortality. This came to us as very good news, extremely good news, because we know that life expectancy is taking a knock in South Africa. But the Rapid Mortality Surveillance Report shows that there is definitely an increase in life expectancy in South Africa, and that actually mortality, especially under 5, as I'm going to show you. The UN AIDS, United Nations AIDS Program, represented today in this meeting by Dr. Catherine Shosi, the UN AIDS Director here in our country, also shows that their outputs have shown that there's a decline in mortality due to HIV and AIDS, that the number of people who used to die of HIV and AIDS, that number is coming down. You'll remember that in our country, nearly every corner of any street was having a funeral parlor, and I understand those are closing now as a result of this population impact. The issue of improvement in child and infant mortality. Under 5 mortality decreased from 56 to 42 per 1,000 live birth. As you can see, in 2009 it was 56. 2010 it reduced to 53. Our target was that by 2014 it must have reduced to 50. That means we were targeting a 10% reduction. But we have reached a massive 25% reduction at 42 by 2011. We are very, very encouraged by that.